Good morning.
Good morning.
Yeah, I'm Adeyemi Sherif Babatunde from Nigeria presently. My PhD biotechnology in Ukatasa is still in view. It's not yet completed. Just to correct the citation. I would like to state that I belong to two institutions presently, University of Ilorin and Ukatasada University in Badoli, Gujarat State, India. But presently I'm on leave in Nigeria. That's why I'm in Nigeria. So I would like to speak on herbal medicine for diabetic mellitus treatment, status and prospects. Before we continue, we should know the distinction between traditional medicine and herbal medicine. Traditional medicine refers to health practices, approaches, beliefs that incorporate several things. Aside plants, they can incorporate animals, several things, even some kind of dancing and music is part of treatment. Void of conventional use of drugs is traditional medicine. And according to WHO, is the knowledge, skills, and practices based on the theories, beliefs, and experience of indigenous to different culture. So this means that in a culture, they may have different beliefs about treatment of diseases and ailments, of which another culture they may say, okay, only water is treatment, and you have to admit that as their traditional medicine. Some people may say when they are sick, they dance, and this dancing is a therapy towards alleviating their disease conditions. And herbal medicine are naturally occurring plant-derived substances with minimal or no industrial processing that have been used to treat illness within local or regional healing practices. And herbal medicine, from the name, you will agree is you source it from herbs, and these herbs are nature's gifts, which are found virtually everywhere, even in Antarctica, where you have seaweeds and very cold condition. You have plants there, and these plants have been put there to serve purposes of disease treatment and alleviation of disease conditions. And there is no way we can start isolation of compounds or discovering compound without talking about the plant knowledge. The healing processes from early man started from usage of plants because there was no conventional treatment then. So in my own view, the oldest form of treatment is herbal medicine. Medicinal plants have several potentials. They have been used to treat malaria. They have been used to treat or manage sickle cell. They have also been used to manage fertility and have served as abortifacient in case of problematic pregnancy. They have used plants to abort pregnancy if the pregnant is having problem. Also, they have been used as anti-neurodegenerative and many more. And more recently, this COVID-19, so many researchers have come out to state the importance of using medicinal plants to alleviate this condition, because we believe that medicinal plants have uh, little or no side effects if used as prescribed. Yeah, diabetes mellitus, which is the main subject matter here, is a group of metabolic disease conditions which is characterized by hyperglycemia because there is a defect in secretion of insulin, there is defect in action, or both. That's what takes us to have like two types or three types, at times four types of diabetes. But we are very popular with two types, type 1 and type 2 diabetes. Is when your blood sugar is raised, this is a common effect of uncontrolled diabetes. And over time, there is the severe damage of several body systems, the nerves, and the blood vessels. Uh, if you have diabetes, there is 100% assurance that these cells and vessels will be damaged, and which will affect different organs in the body, the eye, the kidney, the nerve, the heart, and the blood vessels. So these are the types of diabetes commonly known, type 1 and type 2. Type 1 diabetes is as a result of problem in the pancreas. Uh, there will be shortage of insulin production from the pancreas, and if there is shortage of insulin production, there will be excess blood sugar there will be excess sugar in the blood. So that's why it's insulin dependent diabetes. Why type 2 is non-insulin dependent? There's production of insulin, but there's something with the absorption of glucose from the blood into the cells. So these are the two diabetes we'll be talking about, and for the sake of this presentation, I'll be calling them diabetes or DM. So these are the chronic complications of diabetes according to Diabetes Atlas. So there is diabetic eye disease. We have several other complications of diabetes. And symptoms of diabetes, one will be always thirsty, always tired. There will be sexual problem, wounds that won't heal, frequent urination, hunger, and systemic weight loss. So we know diabetes is found throughout the world, but how prevalent are they? But thanks to researchers that have really worked there to tell us and to project for us, if care is not taken, the number of diabetic patients what we experience in the nearest future. Presently in the world, in 2019, there were 463 million diabetic cases, which was projected to increase to 578 million in 2030 and 700 million in 2045. If care is not taken, we may have more than this. This is just a projection. If we don't take care of our lifestyle, we may have more than this. And in Africa, it's projected to increase by 143% by 2045. Also in Middle East and North Africa, 96%, and Southeast Asia, 74% increase. And if we don't look at the status of medicine, because they've been using the conventional therapies, and patients are faced with several side effects. And we understand that medicinal plants have little or no side effects. So the best thing for the natural product scientists to do is to keep looking and keep searching for medicinal plants that will solve this problem. And I hope very soon we're going to solve this problem. Yeah, this page, this chart is just telling us about the prevalence by age and sex, and also the projection, which I've talked about, and also the top 10 countries for number of diabetes. The top 10 diabetes, the top 10 countries for number with diabetes. China is topping the list, and by 2045, China will still be at the top, while followed by India and Pakistan, Brazil, Mexico, Egypt. They are top 10. So meaning that if care is not taken, some countries may even overtake China and India, so to say. Because if we don't take care of our lifestyle, more cases will be springing up. So conventional management of diabetes and their limitations. Yeah, there are several classes of oral hypoglycemia or hypoglycemic drugs that have been used and that exerts antidiabetic effects through different mechanisms. For instance, oral sulfonylurea acts to reduce blood sugar mainly by elevating insulin release from islet of Langerhans. This mechanism only works with insulin, and if we use sulfonylurea and its derivatives, you have weight gain as side effects, and you have to be using insulin almost every time with the drug. And we have biguanides, which acts to reduce hepatic glucose and hepatic gluconeogenesis, and to replenish peripheral tissues which are sensitive to insulin, and these are achieved through elevation of insulin stimulation, uptake, and use of sugar. And it's also ineffective in the absence of insulin, and several other like that. So let's now talk about herbal medicine. We know the conventional therapies have been faced with several challenges of side effects. So how do we come in using medicinal plants, herbs to rescue the situation? Several people have written thousands of papers on usage of medicinal plants and their derivatives in the combat of diabetes mellitus disease. And I came up with these publications from PubMed to show the number of publications that have addressed the issue of diabetes from 1980 to 2000, and from 2000 to year 2020, December 31st, year 2020. And you can observe from this graphical presentation or illustration that Europe is still having the highest number of publications, followed by Asia, and followed by Africa, by others. Even in Antarctica, we have researches from there addressing diabetes, mellitus treatments, using seaweeds and several natural products there, and several other researches from ethnopharmacology, from Journal of Herbal Medicine. You see several research on medicinal plants usage to alleviate diabetes mellitus condition. And though this is made possible by the reported phytochemicals in medicinal plants. We know these medicinal plants contain secondary metabolites, which are products of plant metabolism that do not take part in the growth of medicinal plants. So meaning that these secondary metabolites have been produced for the benefit of man. So if we don't tap into them, yeah, we are wasting them. So you have to tap into medicinal plants to use the natural products therein and to see the benefits therein. I've come up with several collections of some plants that have been reported to either secrete insulin or to mimic activity of insulin. So we have Acacia arabica, Allium sativum, Egu mamellos. We have Agrimony, Annona squamosa, Camellia sinensis, Gingiva officinale, Hibiscus rosa sinensis, and several other like that. You have Aloe barbadensis, that we call aloe vera, Capsicum frutescens, Bavia diffusa, Eucalyptus globulus, Ficus religiosa, Cinnamomum seylanicum. We have several other plants, but this is just to show us several researchers have worked on medicinal plants and have reported their importance, and we have these plants around us. If we check out the problem we're having with this study, I'll still come back there. So we have also some plants that have been used for glucose uptake, that they act as glucose uptake agents, the same way you have in conventional therapies. We have Juniperus communis, Salix, we have Alnus, Costus pictus, Lycopodium, and several others like that. These plants have been reported to act as glucose uptake active agents in case there's problem in the glucose uptake. Kind of activity has been is similar to what biguanide does in the system. Also, we have alpha amylase inhibitors plants. We have Aloe barbadensis, which has been reported by Abu Sood et al. In 2004 to inhibit alpha amylase and at 80 microgram per ml. And we have Morus alba, which has been also reported to inhibit at 1,440 microgram per ml. Also, Eugenia comini seeds, which has been reported to inhibit alpha amylase at 632 microgram per ml. Also, we have alpha glucosidase inhibitor plants. We have Mucuna pruriens, which has been reported to inhibit alpha glucosidase at 0.8 microgram per ml. This is very active. At 0.8 microgram per ml, there is alpha glucosidase inhibitors. And most researchers now, due to, especially in India, where you have ethical issues towards using animal for experiments, they use alpha glucosidase in vitro assay and alpha amylase in vitro assay to check the activity of the plants and their derivatives. This alpha glucosidase is one of the best assay to check the diabetic activity of plants and natural products. Also, we have Camellia sinensis, which has been reported to be 299 microgram per ml active. This 0.8 and the rest of this number are their IC50, as reported by the researchers. Also, we've been able, researchers have been able to source phytochemicals from plants, and they've reported these phytochemicals and the targets of the phytochemicals have also been reported. For instance, catechin and apigallocatechin gallets have been reported to be isolated from Camellia sinensis and Theobroma cacao, which is cocoa. We have that in Africa. And these two compounds have been reported by the following author to be antioxidative. They have protective effects against oxidative damage. They modify oxidative stresses. They reduce lipid peroxidation by enhancing SOD, GST, and CAT activities. Also, from Cucuma longa, there was curcumin as active ingredient from there, and have been reported to lower blood glucose and also to lower glycosylated hemoglobin levels. Also, camphorol, which has been reported to be present in several plants have been reported to promote insulin sensitivity and preserves pancreatic B-cell mass against destruction. So this camphorol may be useful for those that are having type 1 diabetes, but type 1 diabetes prevalence is less than 10% throughout throughout the world in all diabetes cases, whereby we have 90% plus for type 2 diabetes, which is the commonest and the most common diabetic cases. Also, we have other compound like embelin, which has been isolated from Embella ribes and Listimachia punctata, and has been reported to reduce elevated plasma glucose, glycosylated hemoglobin, and pro-inflammatory mediators, and also erianin, which has been reported by Yu et al. 2016, and isolated from the Dendrobium cristotoxum, which has been reported to inhibit high glucose, induce retinal angiogenesis, fear blocking of different pathways. Also, we've had garcinol from Garcinia indica, which has been reported to decrease plasma insulin and glycogen, high density lipoprotein, and also it has been reported to act against some antioxidant enzyme, and it causes significant reduction in elevated level of blood glucose, glycosylated hemoglobin, and lipids. Also, we have been able to see researchers finding out how medicinal plants can also be checked in human in form of clinical trials, which we have in conventional therapies. And this kind of trial is usually done using the herb, not the compound, the herb, and conventional therapy to see the synergistic effect between the two, so as to recommend plants to patients, as well as telling them the safety when they use with different oral hypoglycemia. And this research has been reported, this was done in 1996 by Bunyapra, I can't pronounce the name, it's very, very long. And this research had 72 type 2 diabetic patients, 49 men and 23 women aged between 35 and 70 years, with high level of fasting blood glucose and a typical diabetic cough of glucotolerance analysis. At the end of the day, this patient did not show response to glibenclamide alone, while the aloe vera juice significantly reduced the level of fasting blood glucose within 2 weeks, and was reported to be safe for both the kidney and the liver. So meaning that aloe vera juice was tested against patients having type 2 diabetes, and it was found to be safe. And it was found to reduce the fasting blood sugar, blood glucose within 2 weeks of usage. Also, aloe vera complex gel has also been reported to be used against 136 patients with prediabetes and type 2 diabetes, and which are not on any medication. And their information as reported here. This clinical, this trial showed borderline significant reduction in body weight, body mass fats, fasting blood glucose, fasting serum, insulin, and Omar Ira after 8 weeks of treatment. So meaning that the claim of indigenous people for using this kind of therapy is upheld, and they are very correct for using medicinal plants to treat their uh, uh, disease conditions, including diabetes. Also, Juglans regia was also reported and has also gone through human evidence trial, and it was found to improve blood glucose by reducing the FBG, the glycosylated hemoglobin, and several other uh, parameters in the system as compared to placebo treatment, which and did not affect the liver and the kidney, but rather showed gastrointestinal disorder, which can be managed. But the aim of using this treatment is already achieved for reducing blood sugar, which is one of the leading causes of death in the world. So we have other researchers also that have reported uh, clinical trials on different plants. Tinospora cordifolia, as reported in 2007 and 2017, Sauropus androgynous in 2002, 2015, and 2016. Gingiva officinale also reported in 2013 and 2014. These are clinical trials. This kind of trials, the requirement is different from the conventional therapy clinical trial, because one of the challenges of usage of herbal medicine is the clinical trial. But WHO came up with a regulation which is solely for medicinal plants clinical trial. This has helped a lot of researchers to check their herbal medicine using human evidence. We know that using rats will give us some insights towards the usage and the efficacy of the compound. But the physiology of man and rats are different. We may just have an idea that, okay, this is this, but when it comes to clinical trial or human evidence, the result may change. And we cannot rely solely on in vitro evaluation of our drugs. So we should also be able to use human evidence, especially when we know the drug we are giving is non-toxic. So that's one of the problem, toxicity. So what's the prospect of using herbal medicine for diabetes treatment? Yeah, we know usage of herbal medicines, medicinal plants were verbally passed down to generations. But a few years back, the WHO encouraged researchers to document the usage or the reports from the local people, which are very close to culture. We should go to them in form of ethnobotanical survey, ask them the plants they found around them, what the plants are used to treat, like that, how the plants are used, so that they will not die with the information. Because if, let me give instance of artemisinin, which is a product of plants from Artemisia annua, which is a precursor of several anti-malarial drugs in the world today. This artemisinin was isolated from Artemisia annua. For instance, if this information about its usage has died with the local people, will there be artemisinin today? No. But thank God the information was still alive and they could get artemisinin from Artemisia annua. Likewise, we natural product researchers need to visit the local people and ask them what plants are used to treat diabetes mellitus in their locality and how these plants are used, and the prescription. Also, the prospects, the use of technology and is helping this research or this the research of finding solution to diabetes mellitus, because there are a lot of technology now to find out whether your plant is active uh, or, or not. And using technology, a lot of mystery, a lot of myths will be unraveled. And there won't be, okay, when you collect these plants in the night, it may not work. Yeah, we can use technology to find out. If when I collect the plant in the night, in the afternoon, uh, we can check the activity of the collection time also. Also, the prospects, number 3, which is stated here, is it's an important contribution to economy because the demand for herbs is on the increase, owing to the fact that they are very active, they are cheap, they have little or no side effect. And several pharmaceutical companies now rely on products from medicinal plants uh, to alleviate disease condition. So the demand for herbs is on the increase, which is going to add to the GDP of any country, especially in India and China. They are the leading exporter of medicinal plants, and very soon other countries also will join, because it's not an eye-opener that we cannot do without using herbs. And for natural product scientists, you can also key into this by growing medicinal plants or sourcing for them, and from this we get we may be gainfully employed using exporting medicinal herbs to some countries of needs. Also, we have challenges of developing herbal drugs for diabetes mellitus. I've thought about the clinical trials. It was once a challenge, but now we are getting over it, because the WHO has given regulation towards testing herbal medicines in clinical trial. Also, analysis and documentation of toxicological and epidemiological and other prognostic-based data and verification of herbal materials is also a challenge. To reduce adulteration, we have to verify the herbs, and also to document toxicology is also a challenge, which several researchers are now trying to solve the problem. And also, evaluation of drug interactions is also a challenge, and standardization is also a challenge. All these challenges are being worked on, and very soon I hope we get over these challenges. And also, therapeutic action depend fundamentally on age, location, and part of the plant's species used. For instance, I may say from Nigeria, a particular plant is used for diabetes at this pace. Maybe I give the IC50, but the same plant may not be active if sourced from Indonesia or sourced from India, because most of the time, since this plant, these are the constituents are secondary metabolites. So this secondary metabolites varies based on the age of the plant, the time of collection, the age of collection, the location of collection. So this is also a challenge, because if I say a plant from here, maybe a plant from India, for instance, let's say Gymnema sylvestre from India, which is also known as anti-diabetic plant. If I find the plant in Nigeria, it may not be as active as the one found in India because of the continental drift, the geographical location, and also the challenge is timing of harvests, and adulteration with microorganisms also is a challenge, and which may affect the standard of herbal medicine globally. So conclusion, for centuries, almost every known human civilization has been using medicinal herbs as effective medication for prevention and treatment of multiple health conditions, including diabetes. This is because of the general belief that herbs are without side effects. They are cheap and they are easily accessible. And recent introduction of cutting-edge analytical techniques and research methodologies, which has increased evaluation and validation of herbal medicine, will make herbs to be continually explored for their efficacy. Diabetes mellitus, as many other ailments, has been reported to be managed using herbs and their derivatives. It is foreseen that herbal medicine will be integrated into conventional medical system, as the herbs are nature's gift. So before I say thank you, this is my university in Nigeria, which was founded in 1975. Is the first choice institution for admission seeker, and these are dam for recreational purpose. This is just the area view of part of the college. Our college is one of the biggest in Nigeria, with top-notch research facilities and hostel facilities for students. Thank you for listening.